Hello everyone and welcome back. My name is Kitty and I'm an academic doctor working in the UK. Since the August changeover, I've now started my core surgical training job and I'm really enjoying it. It finally feels like my training has become more of a priority rather than service provision and being stuck on ward, doing ward jobs as a foundation doctor. Some of you might know already that I was appointed to an ACF ST1 vascular post, which is a completely separate academic application process, as detailed in my previous videos, but as part of this, I also had to go through the benchmarking via the core surgical training application, or the CST application. And I actually did quite well with my CST portfolio score of 64 out of 72, and I ranked around the 200s out of all the applicants in the country, and I got one of my top choice jobs as a result. So today we'll be going through the core surgical training application process and the portfolio scoring system that was used in 2022, which is the year that I applied, as well as what you can do to maximise your points. I will then talk more in depth about the CST interviews in later subsequent videos, and as usual, everything is timestamped for your convenience. So firstly, let's just briefly explain what CST is. So to become a surgeon in the UK, you will need to graduate medical school and complete your 2 years of foundation training years. After this, you can then apply to different training pathways, for example, GP training, IMT for medicine, and CST or core surgical training for surgery. This includes 2 years of 6 monthly rotations in various different surgical specialties before you can then subsequently apply for a surgical specialty, usually starting at ST3. For some surgical specialties such as neurosurgery and cardiothoracics, run-through pathways are available starting as ST1 instead of to CT1, but we won't really go into that today. So in terms of eligibility, the full criteria is available on the AGE website and it's generally pretty standard, and it includes the evidence of having completed your foundation competencies, which is usually automatically achieved by completing the UK Foundation Programme, and this has to be within 3.5 years of the intended start date of the CST post. You have to have full GMC registration and license to practice, which again you'll obtain after completing your F1 year in the UK, or if you're an overseas candidate, you'll need to do the PLAB. You also need to have 12 months of medical experience after your full GMC registration, and crucially, less than 18 months of surgical experience, not including foundation training. So if you've come to apply straight from F1 and F2, this will not be an issue, but keep this in mind if you decide to apply to any surgical clinical fellow jobs after as an F3 or F4, because too much time spent in these posts will preclude your application to the CST. In terms of the competition ratio, this varies year on year, but it's generally getting a bit higher because of the larger number of applicants. So for example, in 2017, this ratio was around 2.5 to 1. In 2021, this has increased to 4.2 to 1 with 2,500 odd applications for 600 posts. The general rule is that around half of the applications, so roughly 1,300, will be shortlisted to interview, and then about half of those will then be appointed. The CST recruitment process is conducted nationally and applications are submitted via the Oriel online system. Overall, the stages of the application is split into the online portfolio self-assessment, the evidence verification, shortlisting and interviews, and then finally the release of offers and ranking your preferences. Based on previous year's timelines, the Oriel application will open around October time, the year before your anticipated CST start date. So for example, for a core surgical training job starting in August 2022, the applications will open in October 2021. You're required to provide information like your previous jobs, your previous degrees, your assessment of your own portfolio, which we'll go into shortly, as well as 3 consultant references. Following the initial application, candidates will then be shortlisted based on your self-assessment portfolio score. The cutoff varies again year on year depending on any changes to the scoring criteria. So for example, in 2021, this was 47 marks out of 72. In 2022, this was 38 out of 72 because of the changes in the scoring criteria that basically made certain things harder. If you are shortlisted, you'll then be asked to upload evidence to support your self-assessment score onto Oriel, so this is usually in December. Your portfolio score will then be verified. Personally, my score did not change, but I know that others have had their score increased or deducted based on the evidence that they provided for verification. If you have a significant point deduction that falls below the threshold for the cutoff, you may then not be invited to interview despite being shortlisted initially. Provided your portfolio score is held up, you'll then have to attend the CST interview, which is usually in January or February, and the interview will broadly consist of a leadership station where you will be asked to present your leadership skills and a management scenario, followed by 2 clinical scenarios in the clinical station. In the past, there used to be a portfolio station as well to ask about your CV, but this has now been superseded completely by the online verification system alone. And as I mentioned earlier, I will cover the CST interviews in a separate video. Your interview and portfolio score will then be combined to produce your final ranking amongst all the candidates. Generally, the portfolio score, the leadership and management station in the interview, and the clinical station in the interview will each make up a third of the final score. You will then be asked to rank your preferences of jobs, and offers will be released in around March with subsequent consecutive offer rounds. You'll have 48 hours to accept a job offer, and you have the option to hold the offer and upgrade on subsequent rounds of offers depending if other applicants accept or reject their offer as well. Okay, so now let's focus on the CST portfolio assessment score. Based on the 2022 criteria, the portfolio score is split into a number of sections as listed on the screen here, which I will go into detail individually. Although there are some changes on the small print year on year, generally these criteria do not change massively and is similar across other specialties applications. I do have a series on my channel about CV building for medical students, which I think also applies to early foundation trainees as well, so if you're looking for a place to start, do check that out as well. The commitment to specialty score component is made up of a combination of things. So to score top points, you will need to show that you have passed the MRCS Part A with evidence of your results. You will need to have attended 4 or more surgical courses and show your proof of attendance, which includes the Royal College courses like the BSS, the ATLS, CRISP and START, as well as really any surgical courses from a recognised or reputable organiser, which can be things like ACID, which is a national organisation, or even courses run by your local trust. There are also the National Catheter Training course, which is a free online course that lots of people do for CST as well. You need to have shown involvement in 30 to 39 or more surgical cases as evidenced by your e-logbook, so make sure you are recording every case that you're in if you haven't started doing so already. This will need to be at the level of assisting or more, so basically as long as you're scrubbed in theatre, it will count. Notably, you will also need to download the consolidation sheets off of e-logbook and get these signed off by a consultant in order to verify that you actually did them, along with their GMC number. I recommend getting cases signed off at the end of each of your foundation placements or medical school placements by one consultant so that you can keep up to date. You also have to attend 3 surgical conferences, and I would really recommend doing these when you're a medical student if possible, because the fees are usually so much lower, and in some cases even free if you enter something like an essay competition or you're selected to present something. Finally, you have to have had some surgical experience as well. So this used to be limited to surgical electives, but in recognition of people who have had their electives cancelled due to the COVID pandemic, like me, a surgical placement in foundation training will now also count, at least in 2022. You'll need a signed letter from your educational supervisor as proof, so again, make sure you get on this early. Don't wait until they've forgotten who you are a year later. If you unfortunately did not have a surgical placement, a surgical taster day can also be counted for some points as well. So these are 5 study days that you are entitled to as an F1, so make sure you do take them because they cannot be carried over into F2 or any of the subsequent years. As evidence, you again need a signed letter from your educational supervisor, and in the past, tasters have sometimes counted for points separately, so I really aim to do this regardless of your foundation rotations, and they're actually genuinely a good opportunity for you to explore some other surgical specialties as well. The next component is additional degrees beyond your primary medical qualification as evidenced by a degree certificate, and all the points here are pretty self-explanatory, so I really won't go into it in detail. The rumour is that for 2023 this will be changing, particularly discounting intercalated BScs, so just make sure you track the criteria when that comes out, but there's not much about that you can do if you're going to be applying in the next 1 or 2 years. Personally, for me, I didn't have an intercalated degree or any other degree on top of my primary medical degree, and I still managed to score really well in all the other criteria, so I really wouldn't worry too much about it. For prizes and awards, to score top marks, you'll need to have been awarded a national surgical prize or received a distinction at final year undergraduate level. Personally, I found that getting a national prize is much more accessible than having a distinction at medical school, but that's just me. I think that you can always find opportunities for prizes by submitting to essay competitions by various royal colleges or specialty groups, they happen all the time, or presenting at conferences or applying for national bursaries for elective or research projects, and I've outlined more opportunities as well in the separate CV building series, so do check that out. For QIP and clinical audit, to score top marks, you will need to have led and completed a surgically themed audit where you have closed the loop. So you must have identified the problem with an initial audit, done an intervention, and then re-audited it to show a change, and you have to have done that for 2 cycles. And you will have to have presented this at a regional or a local meeting. So for example, a departmental meeting or a grand round, so it's very achievable for everyone. You will have to evidence this with a copy of your audit project presentation, as well as a letter from your supervising consultant with their GMC number and the date. General tip for evidence like these requiring a letter from a supervisor, I would just write the letter yourself using the exact wording as outlined in the assessment criteria, and then just get the consultant to screen it, and if they're happy with it, to sign it. This really means that you are meeting the exact scoring criteria, there's no room for argument, and generally makes consultants pretty happy because all they have to do is sign their name without actually writing anything. So really recommend doing that. Something else to note, and this will apply to every component of the portfolio as well, is that you can't use the same achievement for scoring more than one section. So, for example, if you presented your audit, you did really well, and you presented it nationally, this can't then also be used to score for a national presentation later in the presentation section. So just keep that in mind. Teaching experience is another area that has very particular wording on the assessment criteria and require advanced planning to get the top marks. You must have worked with local educators to design and organise a teaching programme with 4 or more sessions, and you must have contributed to 1 session yourself within the last year and evidence formal feedback. COVID to some degree has now made this slightly easier since a lot of courses are ran online, so running a national programme is definitely doable for anyone. To evidence this, you need a letter from the supervising consultant with their GMC number, the dates of the teaching, and stating that formal feedback has been reviewed and deemed acceptable. And once again, so the wording is really particular and quite weird, and so I would just write the letter yourself stating exactly that, basically, for the consultant to sign. The only other thing to be aware, probably, is your role in organising a national teaching programme might not count as a national leadership role, again, for a different section if you claim it here. So just be aware of that. For training and teaching, the top marks are awarded for a Master's in Education, followed by a postgraduate certificate or diploma, and then training and teaching methods of 5 days, and then 2 days, and then nothing. So I would say, unless you have a vested interest in medical education, there isn't really much point in working to get a postgraduate certificate or a diploma or a master's, because they take a lot of time and effort and not very much reward. So if you think about it, a single well-done closed-loop audit will score worth more than 2 medical education masters. So really, I wouldn't worry. And most people will just kind of do the achievable middle ground thing where they just attend courses to meet that sort of criteria for having 5 dedicated teaching days. So that would be things like doing the training the trainers course, or in Bristol, we have a free Foundations in Medical Education course that satisfied the substantial training for 5 days category for me. For presentations, top marks are given for an oral presentation at a national or international medical meeting after being selected, followed by being the first author of 2 or more national or international posters, followed by an oral presentation at a regional meeting, contribution to a national or international oral presentation, and presenting 1 or more regional posters, and so on. You need to evidence this with a copy of the email or letter stating that you've been accepted to present, or the copy of the event programme. I think actually presentations are not that hard to get, and you should definitely be able to at least get a local presentation by attending a hospital grand round and presenting a case. If you've done any research or audits or case reports, honestly, just submit it, throw a lot of it at conferences. There are lots of trainee-directed conferences in particular, such as QI conferences or organisations like ASIT, which will generally accept a lot of projects, so there's really no reason that you can't achieve top marks for this. One caveat here to note is that an international presentation must be given abroad outside of the UK. So even if the conference is international, but is held in London, for example, then unfortunately it counts as a national presentation for the purposes of the CST. For publications, top marks are given for being a first author on 1 or more PubMed-cited publications, not including a case report or an editorial letter. This is then followed by being a first author of a case report or book chapter, and then being a co-author of a PubMed-cited publication, then collaborative works. You'll need to evidence this with a number of small print requirements like a letter of acceptance, proof of your authorship, the PMID, the journal article, the article name that has been accepted finally. So definitely just double check all of that before you submit, and it might require more than 1 document to show all these things, which is fine because there's no limit to how many things you can upload. In terms of how to get a publication or how to get involved in research, my go-to advice is always to ask a research active consultant in your department or specialty of interest as the first line step of action, and they can guide you through the process, since it's really unlikely that as a junior trainee you'll have an idea for a project and then carry it from start to finish by yourself. Collaborative projects are also always available from a number of organisations like StarSurge, Eurosurge, Global Surge, Incision Surgery to name a few, and by specialty group as well. For more information on how to get involved in research, do check out the video on my medical student CV series, which I do outline such of the opportunities available and what sorts of things you can do. And finally, the leadership and management component will give you top scores for having held a national leadership or managerial role for 6 or more months where you have demonstrated a positive impact. This is followed by a regional role and then a local role and so on, so very logical. This is not confined to medical roles only, so for example, if you were a captain of a sports team or something like that, that will also count. And I would advise keeping an eye out for medical or surgical specialty groups calling out for elections every year, because there's almost always a regional or national role dedicated for foundation trainees or medical students to take up that you can get involved in, and it would be very easy to tick that box. To evidence this, you again need a letter from the supervising consultant to include your name, the role, the duration of your role, and what positive impact you achieved. And again, I would highly recommend writing your own letter so that you can make sure you have listed kind of bullet point lists of your achievements and make sure you meet the wording as required for the score. So that's it for the portfolio scoring. I personally scored 64 marks out of 72, so I only lost out points for basically having no additional degrees and no teaching degrees, but otherwise I got full marks for everything else, thanks to mainly just planning ahead. So finally, I want to share some tips for how you can prepare your own CV and portfolio for the core surgical training application. Firstly, get started on your portfolio early. As I mentioned, the overall components that make up the assessment score does not change very much and is very applicable to other specialties as well. Some of these components, such as research publications, presentations, and teaching programs, for example, will take a long time to work towards, so you really need to get onto this early in your foundation training or even as a medical student. Again, not to sort of oversell it, but if you are a medical student or junior doctor who's just started, definitely check out my series for CV building for more details and opportunities that you can capitalize on at an early stage that will make life easier when you come to apply. Secondly, make really focused goals and don't do more than what's needed. So what I did was print out the CST portfolio scoring criteria every year when it was released when I was a medical student, pin it to the wall, and I assessed myself to identify areas where I wasn't scoring high enough and work towards that. And to be honest, unless you have a particular interest in things like research or medical education, don't burn yourself out doing more than what is needed for your application. Once you have achieved the full marks on one component, move on and focus your time and energy on areas that you know you need to develop and score better. If you're tight on time as well, you can prioritize things that will score lots of points with little time and effort. So for example, a first author case report only scores 2 points less than a first author research publication, but realistically takes so much less time and is much easier to achieve as well. Thirdly, be meticulous about evidence keeping. So you don't want to have to look for that random certificate for a course from 2 years ago, or ask a consultant for a letter stating what you did 10 months later when they've already forgotten what happened. So if anything, the CST application process has taught me you should always collate more evidence than necessary for absolutely everything, just so that it's there and ready. Finally, and I cannot emphasize this enough, read the small print. Every year, there are candidates who lose out on points and appeals because they didn't read the small print, like the letter must have the consultant's GMC number, or the e-logbook has to be signed on every page, or it must say this particular word or this particular criteria or anything like that. So don't do something silly like that. For some components like proving your publications, you know, the criteria might ask for an email detailing everything like the PMID, your authorship, that is peer reviewed, that is completely accepted, that might not always be present in a single document. So in that case, just make sure you have all the evidence necessary, upload just all of them so there's no room for argument, and so that you ensure that you get those points. And that's the end of the video. I hope that this has been helpful for those of you who are going to be applying for core surgical training soon, as well as giving an idea of what you need to plan and prepare for if you're considering a career in surgery. If you have any questions, please do leave a comment and I'll try to answer them. I will be making further videos on the CST interview detailing on the leadership and the clinical stations, so do subscribe to get a notification when I release them. That's it for now, and I will see you next time.